Every minute you sit still, gravity actively works against your circulatory system. When you remain seated for extended periods, the blood traveling down to your lower legs physically struggles to climb back up to your chest, causing fluid to pool near your ankles. Over time, this stagnant blood creates serious vascular pressure. It leads to persistent leg swelling, chronic venous insufficiency, and drastically increases your risk for deep vein thrombosis, dangerous blood clots that can form when circulation stalls out entirely. To fight this downward pull, your body relies on a specialized mechanism in your lower legs known as the calf pump. It is a system so effective at pushing blood upward that doctors often refer to it as your second heart. The standard medical advice to keep this second heart beating is simple: you have to move. But active, voluntary movement is often impossible if you are recovering from surgery, trapped on a long-haul flight, or strapped to a restrictive desk job for 8 hours a day. Modern sedentary life has effectively forced this vital pump to power down. To prevent circulatory failure in these restrictive environments, medical science needed to find a way to maintain that blood flow without requiring physical exertion. For decades, the biological consensus was straightforward. This animated diagram shows a cross-section of a contracting calf muscle. As you can see, the muscle bulges inward, physically squeezing the central vein to force fluid upward past a one-way valve. The assumption was that you absolutely needed this active, deliberate muscle flex to pump the blood. But a recent clinical study involving 11 healthy adults set out to test if that effortful squeeze is actually required to keep the circulatory system functioning. Researchers had an active control group perform standard voluntary exercises, deliberately pointing and flexing their feet to engage those lower leg muscles. Then they tested a passive intervention group. These participants completely relaxed their legs while a mechanical footboard, specifically a device called PumpCare, physically lifted and lowered their feet through a full range of motion. The researchers wanted to decouple the physical motion of the foot from the biological effort of flexing the muscle, to isolate exactly what triggers the human circulatory pump. This chart shows the active control group's voluntary flexing achieved a baseline femoral vein flow of 286 milliliters per minute. The passive group produced an identical flow of 288 milliliters per minute. A p-value confirmed zero voluntary contraction yields the exact same result. This blood flow is driven by dorsiflexion, pulling the toes upward toward the shin. Peak venous blood flow occurs precisely at this highest angle. Inside the leg, this upward stretch elongates the posterior calf muscles, horizontally compressing the central veins like a surrogate contraction. The mechanical stretch of the tissue provides an equally potent driver of venous return. Active, sweat-inducing exertion is not an indispensable requirement for vascular health. Understanding this anatomy changes how we treat the lower leg. Stretching the calf muscle is just as biologically effective at moving blood as deliberately flexing it. If you are stuck in a sedentary environment, you do not need to elevate your heart rate or squeeze in a workout to protect your veins. You strictly need to achieve a physical range of motion. For desk workers, introducing a passive foot rocker or an under-desk range of motion board accurately simulates the mechanics of the clinical trial while you work. During long flights or post-surgical recovery, the focus can shift from repetitive leg lifts toward holding a deep calf stretch by pulling the toes upward. The goal is to let the raw anatomy of the stretch do the pumping work, removing the barrier of physical exertion from your daily circulation maintenance. Gravity will continually pull blood down into your lower extremities whenever you sit still, but the mechanical leverage of dorsiflexion provides enough upward pressure to fight back. Whether it is triggered by active exercise or a mechanical footrest, passive mechanical stretching provides the effortless key to keeping your second heart beating.